Hey guys, so today's video is going to be on a very sad topic, and it is going to be all about my patient had a fall, and this was my first patient to have a fall, and I'm not going to really discuss the specifics of the situation because HIPAA violations and patient privacy and all of that. But I kind of want to discuss my views on patients falling, / how I felt about the situation, and let's just get started. So I had my first patient fall last week, and of course I felt sad, I felt frustrated, I felt guilty, I felt like, was there something else I could have done? And looking back on the situation, you're always going to say, like, well, I could have done this, or I should have done this, or I could have done this. But in the end, I felt like I had all of the necessary safety precautions in place for this specific patient. And, some patients need bed alarms. Some patients don't need bed alarms. And some patients, a bed alarm is going to keep them safe. Some patients, it won't. And so, without getting into specific details, every patient is different as far as the safety precautions that they need. So when my patient fell, of course it was at the end of my shift. Aren't they always at the end of your shift? And the patient was fine. They ended up being 100% fine. They didn't have to do any additional tests. The doctor came and saw the patient and everything was fine. The patient actually ended up getting discharged the next day, which was the plan before the fall anyways. But I just felt very sad after the situation because, one, I've only been a nurse for since August, so 4 months now, and I already have a patient fall under my belt. So I felt like, is this going to really reflect negatively on the type of nurse I am? And I did a lot of thinking and talking to other nurses, and in the end, even if you have every single safety precaution in line, patients are still going to fall. And I know that sounds very terrible because I do not wish any patient to fall. But we can do everything possible to try and keep the patient safe, but sometimes things just happen. Or, you may have a bed alarm on a patient. They may be alert and oriented. They may be able to independently move around the room. And then all of a sudden, they just forget that they have an IV pole, or they forget that they have a telemetry box on, and when they try to stand up, it throws them off and they fall. There are just so many factors in the hospital that can cause patients to fall. Medications, safety, hazards as far as, being a new environment, and IV poles, and we have chairs, and we have the beds, and we have blankets, and we have, they're hooked up to telemetry boxes, or maybe they're having a pulse ox, or they're getting vitals every 10 minutes, or whatever it is. There are so many fall hazards in the hospital. So really, as a nurse, it is important that you recognize all of these fall hazards, you educate your patients on them, you put safety precautions in place, and you can do everything to try and keep your patients safe. And sometimes things happen and they have a fall, but I'm just using this experience to grow my nursing abilities and learn from it and keep my future patients safe, or keep this situation in mind. I'm really doing my best to not blame myself for the patient's fall because throughout my entire shift, I felt like I had everything in place as far as what this patient needed for safety precautions. But, that's a hard thing to do because there's always that, what if I did this, or what if I did this? But in the end, I did what I thought needed to be done to keep this patient safe, which was consistent with what previous nurses had done. And, sometimes things just happen and there's not really a reason for it. But all we can do is just be prepared and do everything we can to keep our patients safe. So I know this video kind of was scatterbrained. I'm sorry I couldn't give you specific details, but it's nursing world and HIPAA, and we want to keep things private. So I hope you guys can maybe learn from my experience a little bit and just be extra careful about your patient's safety when you're in clinicals or when you're working. So thank you for watching this video. If you have a similar story, leave it in the comments below. Give this video a thumbs up and subscribe to my channel, and I'll see you guys next time. Bye.